gynecologist from India. Gynecologist from India talks about her specialization in laparoscopic surgeries, high-risk pregnancies, and urogynecology. She did her training and worked for 7 years in England.
Myomectomies are an operation which a woman once has. These are women who have got large swellings in the uterus. These are non-cancerous, and these can grow in any part of the uterus. And the problems which women face are mostly to do with either heavy bleeding or, in younger patients, inability to conceive. So these are the problems which women usually come to us with. And the women who find a lot of problems are the ones who are distressed by infertility, inability to conceive. And this is the treatment which I really enjoy doing, in the sense that myomectomy is a very simple operation to do. And once the fibroids are removed, then these patients have a very good chance of having a pregnancy if it was because of the fibroids that they were not able to conceive. This surgery is being offered either as an open procedure, in which the patient comes, has a small cut which is a bikini line cut, and we go in, take out the fibroids, stitch the uterus back in place, so no problems with the fallopian tubes and ovaries. And once the healing happens, the patient can conceive after about a year or so is a time which I allow for the healing to take place. The other approach is a laparoscopic approach, which is a keyhole approach, and this is suitable for patients who have smaller fibroids or less number of fibroids, because the stitching of the uterus has to be done in the best way, so that once the patient conceives, then they don't have any problems. So this is what is absolutely essential to ensure that and this is what I would assess a patient once I see the reports, examine the patient, and once I am confident that this is what the approach I would like to take, then I would advise them about either a laparoscopic approach is suitable for them or an open approach. And recently one of my patients conceived after myomectomy, which I was very pleased about, and she was having secondary infertility. She had a child 6 years back, and a year back I did the surgery. She was not getting pregnant, and she's conceived. So that is extremely satisfying for these patients who you can do things. And the myomectomy as a procedure is very well tolerated, and the patient needs to stay in for about 2 to 4 days, depending on if it's a laparoscopic surgery, they can go home early, but if it's an open surgery, still we would allow them home by about the 2nd or 3rd day, and the recovery is excellent. So this is what is a good method to do for patients. There are patients who are coming from different commissions and different varieties of patients, and I certainly see the patients coming for, from the South Africa, they come for fibroid surgeries and these, because that is very common in blacks. I think this is something which has a trend, and this is a common thing. The others are a lot of colposcopies and things, that is patients who are living in India are having problems, so they would come and get the tests done. A lot of referrals from the High Commission, because I was trained in UK and I was working in the UK, so the European countries, the way of working, the way of managing the patients in an evidence-based manner is very it is ingrained into me. So this is how I would manage any patient who is international, and whatever is required, you have to be very thorough with them, right from A to Z. This is what is required, and this is what you have to filter out.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.